I'm here today to talk about methadone and how we use it to treat opiate addiction. So methadone is a very, very old medication. It was developed during World War II. And since about the 60s, the late 50s, early 60s, we in the United States have been treating heroin addiction or opiate addiction with methadone. Methadone is an opiate, and so it activates those opiate receptors in your brain, just like heroin, just like pain pills. The difference is that it's very, very, very long acting, so you don't go through those cycles of withdrawal and euphoria that you do with heroin. And when you try to use heroin or other opiate pain pills on top of using methadone, it blocks access to the opiate receptors, and so you don't feel it as much. So methadone is special because it has to, when you're treating opiate addiction with methadone, you have to get it dispensed through it's called an OTP, or an opioid treatment program. The layman's term for that is a methadone clinic. And so basically when they're treating opiate addiction in a methadone clinic, you have to go to the treatment center once a day for 6 days a week for the first about 90 days. And you just go to the window and you drink your methadone, and then you're done for the day. It takes about 5 minutes. And so then you have a steady level of methadone in your body for the next 24 hours, and then you go again the next day. One of the issues with methadone is that if you combine it with other things that are sedating, like medications like benzodiazepines, like Xanax or Valium or Ativan, or alcohol, or other opiate medicines. So if you use heroin on top of it, or if you use pain pills on top of it, the respiratory depression effects can combine, and it's very easy to overdose. So with the alternative medication Suboxone, it's a little bit less easy to overdose, where with methadone, overdoses can happen. Specifically if you're using, again, something else sedating, or if you're using the methadone incorrectly. So some people will use it and they'll inject it, or they'll take more than their allotted amount for that day. So that's what methadone is and how it works.